Hello, today's topic will be on renal system abnormalities, that is anatomical abnormalities occurring in the renal system. So spectrum of structural abnormalities of the kidney, ureter, urinary bladder, urethra will be discussed in this starting with renal agenesis and dysplasia. Agenesis is total absence of the structure and dysplasia is the abnormal development. Renal agenesis means absence of one or both kidneys at birth, and these are autosomal dominant in inheritance. It is diagnosed while evaluating for other problems as they remain asymptomatic, and incidence is 0.1 to 0.2%. They are asymptomatic if it is unilateral. Renal agenesis can be unilateral, can be bilateral. So with unilateral agenesis, a person can lead a normal life with the normal renal function, and it is usually associated with a single umbilical artery. When you examine umbilical stump in the neonatal period, it should be containing 2 umbilical arteries and 1 umbilical vein. So if there is just 1 umbilical artery, you have to suspect unilateral renal agenesis and screen for the child, or at least do an ultrasonogram and find out. Bilateral renal agenesis is incompatible with life, so a person cannot survive with a bilateral renal agenesis. Here it is associated with the Porter sequence or syndrome, which occurs 1 out of 3000 live births. With this problem, usually they do not survive. They may survive just few hours or one day. So this Porter sequence has a wide apart eyes, epicanthic fold, low set ear, broad nose, receding chin, and limb abnormalities. This is a Porter sequence baby, where the mother has a severe oligohydramnios and the baby has all these abnormalities, and life is incompatible. Renal dysplasia. This is abnormal development of one or both kidney. Because of the abnormal metanephric differentiation, the structures remain primitive. So there is primitive ducts leading to formation of cysts. The affected kidney will have many cysts. So wherever there are cysts, the kidney do not function properly. This can be unilateral, this can be bilateral. So with unilateral, symptoms are not much, they are normal, but they have a higher risk of having hypertension in life. Whereas bilateral renal dysplasia, a person will have chronic kidney disease. So a person will be requiring dialysis or renal transplantation. They survive, but they have a sequelae like this if it is a bilateral one. Third, horseshoe kidney. So here if you look at the kidney, the lower pole of the kidney is joint. It is fused and then it forms a U-shaped structure with the 2 ureters coming from two kidneys. 2 kidneys, horseshoe kidney, here the 2 kidneys are fused at the lower poles across the midline of the body, usually in front of the aorta, forming a U-shaped structure. This is the most common renal fusion abnormality, and this also remains asymptomatic. It contains 2 excretory systems and ureters, so it is functioning normally. Incidence 1 in 500 to 1000 live births, and many times this is associated with syndromes like Turner syndrome, Edwards syndrome. Location of the kidney is in the lower abdomen than the normal kidney. The overall renal function remains normal, so there is no renal failure, but it has association or it has some complications. Obstruction to the urinary flow occurs. Due to that, a person may have a hydronephrosis. There is a high risk of hydronephrosis. Infections like urinary tract infection occurs very frequently because of the impaired drainage. So wherever there is a urinary stasis, chance of infection is high. Stone formation takes place because of the urinary stasis, so risk of calculi is more, and vascular issues are there because it is compressing over the aorta. And then the malignancies like renal tumors, Wilms tumor can occur in a higher incidence with a person who has a horseshoe shaped kidney. Now come to ectopic kidney, a normal kidney which is placed in the abnormal sites. So here kidney does not ascend properly. For this reason it is found in the pelvis instead in the lumbar area, in the lower area than the normal area, or over the brim. It can be unilateral, it can be bilateral. Incidence is 1 in 900 to 1200 live births. It is also detected incidentally during imaging studies for other conditions like recurrent UTI or VUR. If you screen or whenever you do an ultrasonogram, then only you can detect this condition because they remain asymptomatic. So a person having ectopic kidney, they are more prone to have obstruction and infections. Polycystic kidney. This is a genetic condition. Kidney is inherited condition which can be autosomal dominant or autosomal recessive in pattern. Autosomal dominant ones, they are more common and they usually present in the adolescent or adult age. So in pediatric usually we do not see polycystic kidney. Autosomal recessive type, it is a rarer form and then it presents during infancy and early childhood. So if they are having an autosomal recessive type, then sometimes we can see polycystic kidney in children age group. This affects both the kidneys. There are numerous cysts in the kidney. The cyst means it is a sac filled with fluid. So numerous cysts, so wherever cysts are there, the kidney will not function properly. So they have impaired renal function and they have a hydronephrosis. This almost all cases will have hypertension, and clinically they have back pain, hematuria, urinary tract infection and renal calculi. Now come to prone belly syndrome or Eagle-Barrett syndrome. So here in the picture, just see the abdominal wall is all wrinkled. Due to the absence of the abdominal muscle, the wall is all wrinkled like a prone. So this is known as prone belly syndrome. This is recognized by 3 triads. So triad number 1 is absent abdominal muscle or deficient abdominal muscle, leading to wrinkle appearance of the abdominal skin. Number 2, urinary tract anomalies are present like dilated ureters, enlarged urinary bladder, kidney malformation can occur. Number 3, cryptorchidism, that is undescended testis. Obstructive uropathy. Obstructive uropathy are all anatomical structures which involves usually the ureter, urinary bladder and then the urethra. So maximum part of the all the obstructive uropathies I have discussed in a separate topic. So here I'll just classify and then will not discuss further. So number 1, in the meatus phimosis occurs. Number 2, anterior urethra, there can be stricture, valve or polyps. Posterior urethra, there is posterior urethral valve, stricture and polyps. And in the urinary bladder, a diverticulum can occur. Pelviureteric junction obstruction, kinks, bands, adhesions and aberrant vessels, calculi can lead to all these conditions. Uretrovesical junction obstruction, a ureterocele can occur, and vesico-urethral reflux can occur, all due to some anatomical abnormalities. So this is very long, so I have discussed this obstructive uropathy in a separate class. Now come to the ureter, obstructive megaureter. This is caused by obstruction at ureterovesical junction. Ureter, vesicle means ureter and urinary bladder. The male to female ratio 4 times higher in males than in females. It is often bilateral and often associated with absent or dysplastic contralateral kidney, usually discovered during prenatal ultrasound. It presents with hematuria, urinary tract infection and abdominal pain. Ureterocele. So you can see the figure of a ureterocele. This is inside the urinary bladder. A circulation of bladder end of the ureter occurs either in the bladder or ectopically. So usually it is seen inside the bladder. It can occur outside also. Female has more incidence than the male. It is bilateral in 10% cases, 90% can be unilateral. It may be asymptomatic or cause obstruction or incontinence of the urine and then infection. Again, chance of recurrent UTI is there when there is a ureterocele. Abnormality of the urinary bladder. So, extrophy of the bladder can occur. Here, there is absence of anterior wall of the bladder with ureters delivering the urine into the lower abdomen outside. It is associated with other abnormalities, especially epispadiasis, that is abnormality in the opening of the urethra. It requires a surgical reconstruction. So externally from outside you can see the urinary bladder is opened like this and then urine is passed outside. So feature of again extrophy bladder. It is visualized externally like this. Ectopic urethral orifice. So coming to the urethra, usually this occurs with the ureterocele and duplication of the ureter. There are two types, one is hypospadiasis, one is epispadiasis. So hypospadiasis, urethral opening is at the undersurface of the penis. Instead of being in the central of the penis, it is in the undersurface of the penis. And this is more commonly seen. So another abnormality is epispadias. Here the urethral opening is on the upper surface of the penis and in the males, and in females it is in the region of the clitoris. So they may present with the incontinence. So this is epispadias. This is less commonly seen. Come to urachus. Urachus is a tube-like structure which connects urinary bladder to the umbilical cord during the fetal life. So if it is remaining persistent, this is known as persistent urachus, means failure of closure of urachus after birth. So it remains patent, so urine is coming through the umbilicus. Patent urachus, the entire urachus remains open, urine is discharged from the navel. So from through the umbilicus urine is getting discharged in this condition. Urachal cyst can be there, urachal sinus can be there, urachal diverticula. So urachal cyst, a part open forming fluid filled cyst gets in, and this gets very infected. Just a part of the urachus, it is filled with fluid forming a cyst, and then this part will get infected. Whereas urachal sinus, urachus open at the umbilical end and then discharge, it is getting discharged from the umbilicus, same as the patent urachus throughout. So urachal diverticula is open at bladder end in a pouch-like structure, creating a irritable bladder and then again a risk factor for infection or urinary tract infection. We'll see you in another class again.